Mr. Speaker, to the bill.
To the bill.
Colleagues, I am a pediatrician. The health, safety, and well-being of children and young adults is my professional calling, and it informs everything I do in the exam room as well as in this building. For this reason, I stand in strong support of House Bill 2002. And I speak on behalf of not only myself and my MD colleagues using the titles doctor and physician, but I also mean to include the wide range of healthcare providers, including nurse practitioners and physician assistants. The trusting relationship between a healthcare provider and a patient is integral to positive health outcomes. At the root of this relationship is the provider's ability to base their medical advice on their patient's needs and on science, full stop. Medical advice should not be based upon political wins or politicians' personal beliefs. Oregonians deserve the freedom and privacy to access the medical care that they need under consultation with their doctor and not consultation with elected officials. Taking care of young patients is a unique privilege, one that I take incredibly seriously. And in my routine checkups with patients, which I kind of consider getting to know you visits, I ask about their circle of support. I actually make a drawing of concentric circles and ask them to name who is in your inner circle. Who do you turn to for advice and for comfort and for support? And can you invite more people into your inner circle? And I certainly encourage them to include their parents if they are not already there. I help patients talk to their parents, and I often get permission from patients to share their medical and other personal information with their parents. I know that ideally it's vital for young people's parents to be engaged and informed about their children's care, and this is standard of care throughout pediatrics. And when I find myself in an exam room with a young Oregonian needing help, whether it's with depression or a pregnancy or gender dysphoria or a history of abuse, I go back to that circle of support. I encourage them to reach out to that circle and ask where their parents fit in there. I offer to sit in the room with them as they share their current struggle with their mom or dad or even their older sister. These can be tough conversations, yet we come together to form a cocoon around that young person and work together to help bring treatment, comfort, and relief. And colleagues, I have seen firsthand what access to appropriate care means to my patients and to their families. And when we can validate and support a young person who experiences concerns about their gender, well, it can be life-saving. Just ask any parent who has taken this journey with their child. Sometimes, sadly, though, the patient's parents are not the adults in the young person's life that can offer the safe support that is so crucial for that young person. Sometimes, in fact, the inability of a parent to appropriately respond to their child's needs can be incredibly harmful. When in situations like this, a parent is not part of that inner circle, we build a cocoon of trusted adults, and then we help that young person through decisions and treatment options. We put the health and the safety of that patient front and center as we find the community that will provide support and love and nurturing. So when I hear concerns that there are medical treatments or even private discussions that might be made without parents' knowledge, I want to make abundantly clear that this is only in the infrequent and heartbreaking circumstances when the parents are not the safe adults in that young person's life. And then we identify and involve trusted adults to surround and carry that child or adolescent through the challenges ahead. I do feel I need to reference one more thing. We've seen questions and discussions specifically around pregnant 10-year-olds. Astoundingly, the fact that seems to shock the folks advancing this narrative is the possibility that a 10-year-old might have an abortion without their parents' knowledge, instead of the horrible fact that a 10-year-old has become pregnant. I want to be clear. If a 10-year-old is pregnant, a horrific act and crime has taken place. If a pregnant 10-year-old came to see me, and I feel incredibly grateful that I have not had to confront this in my exam room, but I would tend to that child, and then I would call law enforcement and child welfare. A criminal investigation must and will take place. And remember, all healthcare providers are mandatory reporters, as we all are in this chamber. If a 10-year-old becomes pregnant, our focus must be on the health and well-being of that child and ensure that this victim, this survivor of an unspeakable trauma, has the access to the life-saving care that they need, including the need to be surrounded by a loving and supportive community. Colleagues, House Bill 2002 will ensure that doctors can provide the care that their patients need. This bill expands access to reproductive health services such as screening for sexually transmitted infections and dispensing contraception. Almost 500 healthcare providers, through a floor note on your desks, ask that healthcare decisions be made without politicians inserting themselves into our exam rooms. They urge you to support this legislation. And of course, all healthcare providers work to ensure the health and safety of Oregon's children and adults. As a pediatrician, as a lawmaker, as a woman, and as a mother, I urge you to vote aye on House Bill 2002. Thank you.